Happy New Year, and welcome back to Season 2 of the Community of Innovation podcast, brought to you by the Center for Aging and Brain Health Innovation, otherwise known as CABHI. I'm Allison Schooler. I'm the Managing Director of CABHI and also Vice President Research here at Baycrest.
And I'm Roseanne Alliong, Director of Research, Innovation, and Translation at Baycrest. As January is Alzheimer's Awareness Month, today's podcast focuses on Canada's National Dementia Strategy. What it is, what are its goals, how it will impact the lives of persons living with dementia and their caregivers, and importantly, how does innovation play a role in achieving that impact? So, Allison, we had a couple of great guests.
Yep.
What's your takeaway?
I thought the conversation that people are going to hear in a moment was really interesting. And one of the most important things that we talked about was this national dementia strategy, the fact that Canada now has one for the first time. And we talked with our guests about that, what it means and why we need it. And I thought one of the things that was really interesting is that although healthcare is a provincially mandated function within Canada, the relevance of having that national coordination it just can't be underestimated. It's bringing people together across the whole country so that we make sure that there's a unified approach to attacking this issue of dementia. I thought that was really critical.
And I think our guest really talked about, understanding that strategy applies to everyone across the nation. It's about driving accessibility no matter where you are, that you know what type of care and what you can expect in the context of prevention, treatment, a cure with regards to dementia. And so that really resonated with me in terms of that accessibility piece.
Yeah. And the other thing I think that really came home was the importance of this now more than ever in the time of COVID, right? With the pandemic, we've got everyone sort of locked up, staying home as much as they can, which is great. But of course, what that means is that people aren't sleeping as well. They're not eating as well. They're not doing all of these kinds of things that we've already talked about on other podcasts that we know are important for preventing dementia. And so we had this public health crisis of dementia already. And this is indirectly, I think, potentially going to just increase that. So you've got the older adults in Canada and around the world being hit by this double whammy, that they're more susceptible to COVID. And then to protect themselves from COVID, they may be reducing their ability to stave off dementia. So I think now more than ever, we have to make sure that we can do whatever we can to address the needs of older people. It's just really come to a head.
And I think our guests even go as far as to, earmark some particular areas of opportunity that innovators should be really looking at. So, we've always talked about how can people pivot? So they may have existing solutions, but they didn't really think about it in the context of older adults or persons living with dementia. And our guests really highlight some challenges that I think will help people think about how can I pivot to help older adults, persons living with dementia, caregivers with the solutions and ideas I already have. And so that call to action for our audience to really think about how they can help move the strategy forward was really key.
Yeah. And they highlighted, I think, for us that part of the strategy is built into it. I think there were almost 50 different mentions of the word innovation, with one of our guests mentioned. The fact that that's mentioned so much just shows how critical innovation is for making sure that the national strategy is going to be successful, because you can have great ideas, you can have great research, you can have all sorts of great policies, but if there's no movement from ideas to impact, it's not going to mean anything. And that's where the innovation side of things really comes in.
And I think, that impact piece was key across a lot of different settings. So right now we have a lot of conversation about long-term care, a lot of conversation about older adults in the community. And so our guests really highlighted a lot of different perspectives, I think, around the challenges, people are facing right now. So I think our audience is going to really learn a lot about a variety of different spaces, settings, and groups.
Yeah. And so I think that's all back to the issue of accessibility that you raised before. So it goes around in a nice, complete circle. And I think we should just let our listeners hear the conversation. As we kick off the pod, we'd like to welcome our guests. Dr. William Reichman is the President and Chief Executive Officer of Baycrest, among the world's premier academic health organizations focused on seniors' health and residential care and aging and brain function. Dr. Reichman has an appointment as a professor of psychiatry with the Faculty of Medicine at the University of Toronto, and he is a recipient of an honorary degree of laws from OCAD University. He is a noted global authority on the delivery of innovative medical, mental health, and dementia services in geriatric care settings. And he's also currently the president of the International Psychogeriatric Association, and he has advised the World Health Organization and the governments of Canada, the United States, and China on health policy. He's also co-chair of Canada's Ministerial Advisory Board on Dementia, and he's been instrumental in the development of Canada's National Dementia Strategy. Welcome, Bill.
Thanks, Allison.
Our second guest is Dr. Saskia Sivananthan. She is the Chief Research and KTE Officer at the Alzheimer Society of Canada, a leading not-for-profit health organization working nationwide to improve the quality of life for Canadians affected by Alzheimer's disease and to advance the search for a cause and cure. She is an internationally recognized strategy and policy advisor on dementia care, a neuroscientist, and a health data scientist. While consulting for the World Health Organization on its global dementia strategy, she co-drafted the WHO's Global Action Plan on the Public Health Response to Dementia, which was unanimously adopted by all 194 member states. A recent appointee to Canada's Ministerial Advisory Board on Dementia, she is also the co-lead for the inaugural Non-Pharmacological Interventions Working Group of the Canadian Consensus Guidelines on Dementia, which developed the first national recommendations on psychosocial interventions for the management and treatment of dementia. Saskia, welcome to the pod.
Thank you for having me.
Bill, in the introduction, I mentioned that you were the co-chair for the Ministerial Advisory Board on Dementia to develop a national dementia strategy for Canada. Can you tell us just a little bit more about what is the National Dementia Strategy? How is it developed? What are its objectives and goals and so on?
Yes, certainly, Allison. Well, the National Dementia Strategy emerged after several years of advocacy with the federal government of Canada for Canada to join other G7 nations to launch a national effort. Originally, there was a comprehensive report on dementia from the Senate of Canada that was issued in 2016. And then in June of 2017, Parliament issued the National Strategy for Alzheimer's Disease and Other Dementias Act. And within that act, there were several imperatives for the federal Minister of Health that included developing the National Dementia Strategy, hosting a national conference to launch this effort, and to then establish a ministerial advisory board on dementia that I've had the privilege to co-chair. Essentially, the strategy has three essential goals. One is to prevent dementia. Two is to advance therapies and find a cure. And three is to improve the quality of life of people living with dementia and caregivers. And under each of these primary goal areas, there are objectives that are more specific to guide the nation's efforts. Finally, Allison, I'll just say that the strategy has a vision which anchors it. The vision is a Canada in which all people living with dementia and caregivers are valued and supported. Not surprisingly, quality of life is optimized, and dementia is prevented, better understood across the nation, and effectively treated.
So Saskia, can you share with our audience, what is the scale of the challenge that you're hoping the strategy will address? Why is it important to have this type of policy and strategy document in existence?
It's a great question, Roseanne, and I want to actually reflect a bit on Bill's comment. It is a strategy to be proud of, the fact that we do have it. For the Alzheimer Society in particular, it has been 10 years of advocating for a Canadian national strategy on dementia. And the question comes up quite frequently, well, why do we need a national dementia strategy when in Canada, healthcare is delivered provincially? But I would argue there's huge value to taking a national perspective to dementia care. Because in essence, what the strategy allows Canada to do is twofold. First, from an international stage, we would be joining other G7 countries. And in fact, we were one of the last to join in developing a national strategy and using that to be able to push forward policies that will better support people living with dementia and their caregivers. But for Canada itself, what the strategy would allow Canadians to feel is that it shouldn't matter where you live. You should still know and be comfortable that you will be able to receive the same quality of dementia care. So it doesn't matter if you live in Vancouver or Yellowknife. You should be able to expect that you will receive the best and high quality dementia care. And that is where a national perspective is so essential. When you think about the scale and scope of this disease, we have well over 500,000 Canadians currently living with dementia. But dementia touches 1 in 2 Canadians. If you look at your circle of friends and family, you will know at least one person who's either living with the disease, caring for the disease, or has a loved one in their circle who has that disease. And this is the scope of what we're dealing with and why this strategy is so essential.
Yeah. How does the document translate into everyday impact for Canadians, whether they're living with dementia or not? As you mentioned, they might be caregivers or know people with dementia. Why does having this document help us both in short term and long term to address the issues related to dementia? I throw that open to both of you.
Well, I can start. I think that, if you get down to some of the more detailed content of the strategy, you'll see what the most important objectives are. First, just getting back to the question you asked, Saskia, I completely agree with her answer about, why a national strategy is important. I would add that a critical part of the strategy is for Canada to step up as a country and make its appropriate contribution to the global research effort to end dementia and specifically Alzheimer's disease as the primary cause. So if you look at the strategy, it very explicitly calls out that Canada, in advancing therapies and finding a cure, has to establish and review strategic dementia research priorities for the country. Advancing research is clearly a federal government commitment. Strategy calls for increasing dementia research, developing innovative and effective therapeutic approaches, and that requires national support and a national funding effort. Alison, to your question, I think that the strategy also calls out the need for the country to ensure, as Saskia said, irrespective of where someone lives, that they have access to timely evaluation and assessment, they have access to therapies, and that their care providers are well trained and equipped to meet the myriad needs that all individuals and their families have with dementia. So there's much in the strategy which sets the expectation that the well-being of people at risk for and living with dementia will be more effectively addressed on a Canada-wide basis.
Yeah, and I totally agree, Bill. And I'd actually say the strategy is also a rallying point for Canadians and for policymakers, for decision makers. It allows us to focus and look at what do we aspire to achieve. And that is what the strategy is about. It's aspirational goals. And, to Bill's point, one of the key goals in there is really focused on research, advancing therapies, notice the plural, to finding a cure. And in particular, one of the only goals with a qualitative measure is for research, that an annual investment in dementia research in Canada exceeds 1% of dementia care cost. And that's anywhere between 100 to 150 million annually. And it's one of the key goals that has a number to it, which I thought was really wonderful to see in the strategy.
And do you think, given that it's a national strategy, research and all of those other sorts of things and healthcare happens provincially, but do you think that the fact that it's a national strategy is an incentive of some sort to get folks to be collaborating more within a province, across the provinces, across the whole country, to be sort of taking a more coordinated approach? And are there benefits for that, both in the short term and long term?
Yeah, I was just going to say, Saskia and Alison, that actually the strategy also is anchored by 5 pillars that are essential for the effective implementation. And one of them is exactly what you just said, Alison. It's collaboration.
Yep.
So we saw that as a vital attribute for the strategy to become real. And the other pillars are research and innovation, surveillance and data. This is a critical need across Canada to have an understanding, a much better granular understanding of the public health impact of dementia and to use those data to help us prioritize our efforts, information resources, and a skilled workforce.
Yeah. And Saskia, you were going to say something about collaboration as well?
I was, yes. The point I was going to add was that, so we do have provincial dementia strategies and plans, and rightly so. They focus primarily on the delivery of care, sort of the pathways of care. But there's huge value to taking a federal and a national view to it. We're able to learn from each other. Well, what are you doing in BC, for example, that could be done in Alberta? Are there strategies that have been deployed in Ontario that could be modeled or duplicated in Nova Scotia? It's not just about scale and geographic differences. There's a lot to be learned from that collaboration and taking that national perspective. But I think also, to Bill's point, when you look at the national dementia strategy, both at the 5 pillars and the 3 main objectives, very squarely within the federal government's scope of being able to resource and oversight. So it's quite valuable that that's the approach that's been taken. And just from my perspective at the World Health Organization, when we were developing the Global Dementia Action Plan, Much of Canada's National Dementia Strategy parallels the recommendations that were made in the Global Dementia Action Plan. And that action plan was built on looking at best practices and scouring all of the global policies and strategies to pull out what would be and what are the best practices and recommendations that can be put forward.
So I guess building on that conversation about national imperative, this past year with COVID-19 is definitely highlighted as a national issue, the need for coordination. And it's obviously put a spotlight on older adults, whether that be in congregate settings or in the community. So I guess, Bill and Saskia, from your perspectives, what have been the particular challenges that COVID-19 has posed for persons living with dementia and their caregivers? Bill, do you want to kick us off?
Sure. So I think clearly there's been a dramatic impact on the lives of all older adults and their families, but specifically, the impact has been quite extraordinary on older adults living with dementia, both in the community as well as in congregate care settings, such as long-term care facilities or freestanding memory care facilities. Many of the constraints, the requirements to prevent the spread of contagion have led to worsened social isolation for people living in the community with dementia. The change in routine, both for people out in the community as well as in congregate care settings, has been particularly destabilizing for people with dementia as they rely on routine and familiarity to get through the day. It's been very hard on caregivers to be able to ensure adequate respect for some of the measures that are required to prevent the spread of illness. So it's hard for people with dementia to comply with using personal protective equipment. It's hard for them to understand the rationale behind and the need for measures like physical distancing. The lack of connection with family members for those living in long-term care as a result of restrictions on visitation has been particularly devastating. So there have been just a host of adverse consequences that have impacted people living with dementia and those that care for them.
So I know we just recently did an episode on caregivers of persons living with dementia. We just tackled the issue of sleep during the COVID-19 pandemic. I guess building on that and Bill's comments, Saskia, from the Alzheimer Society of Canada's perspective, would you concur with Bill's, comments on the impact?
Yes, I would. And I'd add to that long-term care in particular has been in the spotlight in media and is really a glaring example of how things can go wrong when you don't have national standards and when a whole system is completely under-resourced, because a lot of the issues that have just now come to the spotlight existed for years. It's just that the chasm has broken open because of the enormous pressure that COVID-19 has placed on the long-term care system. What we often don't talk about is also the impact of those living in the community, and particularly people living with dementia in the community. And this is where, Bill summarized it really quite well. With the pandemic restrictions, it has also meant that people living with dementia can no longer go to day programming. Both people living with dementia and caregivers don't have support groups anymore that they can access. And there's a whole technological divide, even when we've pivoted and been able to offer these programs online. And so for the Alzheimer Society, I can't tell you about the number of calls that I've been getting from caregivers who are in crisis, who have nowhere to turn, don't have the resourcing they need to be able to continue to provide this care in an ongoing way. One last stat I also do want to point out is that it's unfortunate Canada is a leader in this number, but just the sheer number of deaths of people with COVID-19 have been in long-term care. And when you consider that well over 2/3 of people living in long-term care have dementia, that actually means that the vast majority of those who've died of COVID in Canada have likely been people living with dementia. And we're still collecting that data and trying to understand it. It's a very sobering fact.
Saskia, because you mentioned the impact of potentially trying to adapt our methods of working with older adults in the context of COVID. And that's really what we're focused on at CABHI. We're committed to supporting and driving innovation in aging and brain health with a particular focus on dementia. And recently, obviously, a number of our innovators have tried to pivot, and many with great success, to address exactly the kinds of issues that you were mentioning. So, for example, just as one sort of case study, something that comes to mind is MemoText and their patient engagement platform, Ring of Support, which CABHI funded through our I2P2 program. And really what it's doing is it's leveraging Amazon's Alexa's voice assistant to provide older adults, people living with dementia and caregivers, personalized daily reminders like taking medication or attending a doctor's appointment. And initially, their platform was addressing sort of that broader need for virtual healthcare. But once COVID came on board, they really went above and beyond to try to make sure that people would have access to it, because it became even more important in the context of not having the regular access to physicians and so on and so forth and all these other supports. So they created a voice-activated screening tool for older adults at home. And since it's been launched, it's now been deployed in over 18,000 homes. And undoubtedly, it's helping older adults and people living with dementia and their caregivers stay safe and healthy during that pandemic. And it just raises this idea that innovation, in addition to, Bill, you mentioned one of the pillars is research and innovation. We've talked about research, but the innovation side of it is really so critical.
So I guess building on Allison's case study, Bill, can you tell us a little bit about how innovators like Memotex, but also frontline providers and researchers can activate the National Dementia Strategy?
Well, I think that, first of all, we need to make sure that the innovation and research community is aware of the strategy. So we have to promote it more. And I would imagine that once people get a chance to look at some of the very specific items under each of the major areas of focus, they're going to see opportunities. So, I think that any innovations or research findings that help us to better understand modifiable risk and protective factors, and then interventions to get more people to address those risk factors would be very helpful, whether these are, apps that can be developed for people's smartphones, whatever it needs to be. We have to build awareness on how we as individuals can help to prevent dementia. I mean, it's been identified now that perhaps 40% of the risk for dementia are modifiable factors that are under individuals' controls. So innovations that help individuals to take better control over their health decisions, their lifestyle decisions would be very helpful. I think as well, one of the real challenges we have in the context of a pandemic are challenges unique to dementia care. Dementia patients have a tendency in congregate care settings to wander, which further increases the risk for spreading infection. And so I think innovations that help us to address the causes of wandering and how to mitigate the potential risks would also be very helpful. Interventions that include programs of one sort or another that capture the attention of people with dementia so that they can sit quietly for extended periods of time and be enriched in the process instead of being constrained or restricted to their rooms would also be very helpful. So I would just urge that people go to the Public Health Agency of Canada website or the Alzheimer Society of Canada website and become more familiar with the areas of focus and some of the specific imperatives. And I think a lot of innovators out there are going to see areas that perhaps they can focus on in finding some solutions.
Thanks, Bill. Saskia, from your perspective, what would you advise innovators to do to, get involved with the strategy?
I do agree with Bill. In fact, I was rereading the strategy thus this morning, and innovation is mentioned 49 times. It is a clear focus in the strategy and will be, I'm sure, in the implementation of the strategy as well. But I think innovation, it's one of those terms that's quite broad and can be used in many ways. I mean, there's absolutely technological innovation, as you've just identified with one of the programs that Allison was mentioning. But innovation can also be in taking what might have been existing or different programs or techniques and applying them in a new environment or in a new way. And so for me, what comes to mind is the First Link program. So for the Alzheimer Society of Canada, the First Link program is a system navigation program. In essence, we were looking at how other people in other diseases navigate the health system. And we recognized that particularly for people living with dementia and their caregivers, because there's no clear pathway of care, it's a fairly chaotic system to navigate. And so First Link came into being to help people navigate the health system. It's one-on-one, it's tailored, it's personal. You'll have a First Link navigator if you call the Alzheimer Society, work with you and help you understand where and how you can move through the health system. But to Bill's point, there are many other really major innovations that have come out quite recently around prevention and risk reduction. The recent Lancet study that he mentioned, where we now know that almost 40% of dementias could be prevented if we targeted those risk factors and actively work to reduce them. So that includes things like nutrition and the kinds of diet that you have, your sleep, hearing loss. And these are ways in which people who are interested in activating and engaging with the National Dementia Strategy can become involved. For example, we have the Alzheimer Society Research Program, and through it, we fund specifically proof of concept grants. And so these are meant to be only innovative ideas. So the kinds of ideas where there is no data, they're pushing the boundaries of research. You're exploring a whole new area outside of, let's say, for example, amyloid and tau, and you want to explore other sorts of theories. Well, you can get funded through that proof of concept granting program. So these are the ways in which you can explore and learn more about how to push innovation forward.
Yeah. And one thing that's interesting is people who are going out of research and don't have a fully formed company, especially if they're working out of frontline care. We do have a program from CABHI called Spark, which is particularly aimed at trying to move things along from that initial research stage into that, sort of impact stage. So from ideas to impact is how I think about it. And I'm wondering, in talking about these needs of making an impact, what are the areas that you guys think innovators ought to be focusing on to move that needle more towards impact? And especially in the COVID area, we were talking about the National Dementia Strategy, and it lays a framework, but in the context of COVID, does that change what people ought to be doing at all? Should it be affecting the way that we think about the strategy? And should it be, what's most critical now in the context of innovation and dementia, given the COVID context?
Well, I think what Saskia said earlier is very important, and that is what COVID has done is not so much cause novel problems for people living with dementia, but it's exposed chronic weaknesses in how we support their needs. So I think that, for example, one thing that's clear, and Saskia, you made reference to it in terms of the impact that COVID has had on congregate care settings, such as nursing homes, is that we need to rethink through innovation how these environments are constructed and to ensure that people can live safely and happily, not be crowded, that staff can interact in a much more effective, less dangerous way with people living with dementia. And as I said earlier, there are innovative activities and programs that can help keep people living with dementia feeling calm, not needing to be restlessly wandering, not having a tendency to wander into the wrong spaces like somebody else's room. These are long-standing challenges that we had in long-term care of people with dementia, but the COVID pandemic has made these long-term care challenges a crisis because of the risk of infection and what Saskia said before, the enhanced morbidity and mortality that has resulted.
Yeah. And obviously, as we've discussed, it is long-term care is really critical to address, but also people living in the community. So Saskia, I'm wondering, are there areas of impact that you think innovators should be focusing on in the community as well?
Yes, absolutely. It's a good question. Certainly, long-term care has a lot of room for innovation and for better design, both from a programming, care, and environmental perspective. But the same goes for community settings as well. And some folks might be familiar with dementia-friendly communities. And the idea behind it is, again, the idea of innovation doesn't always mean having to create something wholly new from scratch. It could be taking existing ideas and applying them in new ways. And so dementia-friendly communities tries to exploit that. The idea behind it is that we create communities that are supportive and friendly and encouraging for people living with dementia to continue to remain in their community, to continue to not just remain living in the community and in their homes, but also to be engaged in their community, to be able to interact with it. So to be able to grocery shop, to be able to take the bus, to be able to stroll down the street. And some of the innovations to enable that could be fairly simple. For example, it could be broadening the sidewalk and, innovating in terms of the signals and the colors that are used for stopping or crossing sidewalks. And all of that, I think, comes back to the idea of if you can create a dementia-friendly community, so a community that is supportive for people living with dementia, more broadly, it's going to be a friendly community for older adults and for others who may have accessibility issues. So overall, it would be setting new standards.
Yeah, I completely agree. I think another area where innovation now is going to be very substantially catalyzed is going to be in virtual healthcare delivery and telemedicine. Before the pandemic, it was already evident that it was hard for people living in the community with dementia to access healthcare, to get to their doctor's office, as Saskia said earlier, to even get to dementia daycare. And I think that with the experience of the pandemic making that so much more challenging, we are hopeful that we'll see many more innovations to enhance the accessibility and the user friendliness of virtual care technologies, as well as perhaps virtual daycare. Just because daycare is open in a community in the post-pandemic period doesn't mean it's so easy for somebody to access that. And so being able to deliver that kind of programming out into the community without people having to physically necessarily go to a location, I think that those kinds of efforts are going to be enhanced. And, we're working on that right now at Baycrest, creating a new virtual daycare platform. I'm not sure we would have ever thought of that until we saw the impact that COVID had on people's inability, as Saskia said before, to get to their daycare programs.
Yeah. It's interesting because we've sponsored the Baycrest at Home program is what I think Bill is talking to. And as folks know, Baycrest at Home is actually one of the co-sponsors of our previous series of COVID podcasts. And it really did transform over the course of COVID, and it amplified it and it changed its focus. And I think it also sped up the development. And we've seen that in other areas too. So CABHI has sponsored a whole bunch of virtual care programs, including things like Jerry MedRisk, which already, had a great runway going. And this just helped them get out there even faster, and it really amplified the importance of what they were doing. But also in terms of training, we've got other programs like Tralta, companies like Tralta that we sponsor that provide virtual training for caregivers, for example. And the need for that, I think, has also really been amplified. So I think if we can find, Bill, you'd like to talk, I know, about how can we make lemonade out of the lemons that we've been given. And I think that really is one of the big lemons into lemonade stories that we've had, right? That it's advanced innovation and recognition of the need for innovation just completely.
I couldn't agree more with what you've just said, Allison and Bill. And I'm glad you brought up telemedicine in particular, Bill, because I think within the healthcare sector, we've been rather hesitant to fully shift and embracing telemedicine and virtual care. And the pandemic has forced that upon us. And that doesn't come just for, older adults or people living with dementia or their caregivers. It's also for the medical community and for healthcare providers. And we've heard that through healthcare providers that we work with and through the COVID and Dementia Task Force that we brought together. It's made up of healthcare providers, people living with dementia, and frontline staff across the country. And one of the pieces that they highlighted to us was that telemedicine has opened up whole new opportunities. Because if you can imagine previously, so pre-pandemic, to go in to visit your geriatrician or your family doctor, perhaps, and especially when you might be at the more moderate to late stages of dementia, your family member or caregiver probably has to take the whole day off. You've got to get there early. You've got to park. You've got to go in. It takes about an hour to 2 hours. Then you've got to come back. It disrupts the routine that might have already been set in place for a person with dementia. It's discombobulating. You're in a whole different environment. You have a battery of tests being thrown at you. People that you're not familiar with who are talking to you and asking you questions. Part of the value of telemedicine, if we get it right and if we design it well for people living with dementia, is that eventually we might be able to get to the point where we would be able to hopefully diagnose, but at minimum be able to manage dementia through virtual appointments and through virtual, whether it's via telephone or Zoom or using any of the sort of virtual platforms that are currently available. And that's something that the Alzheimer Society has also been supporting to move forward.
So I think as we wind down the episode, we always kind of ask our guests about a call to action and a resource. So I guess my question to you, Bill, is what would you want our listeners to know about how they can move the strategy forward? How can they get involved? And then you've already mentioned a couple of resources, but if you want to call out any kind of activity or event or resource that you think our listeners should learn about, please share that with us.
All right. Well, again, I would urge all listeners to the podcast to access the National Dementia Strategy. You can do so in a variety of ways. Just by Googling it, it'll take you to a variety of different sources, and you will see your role in the implementation of the strategy when you've had a chance to read it. I have little doubt about that. I do think it's going to take a village to ensure that Canada makes its appropriate contribution to the global research and innovation effort in dementia. And that requires then the appropriate per capita investment in dementia-related research. Right now, we do not fare very well in comparison to the other G7 nations. And I think we need to make a very deliberate decision as a country. Are we going to be in the top quartile of G7 nations in terms of our per capita expenditure, or are we going to be in the bottom quartile, which is where we presently reside? So I would urge you to do your best to influence policymakers, your elected officials, to highlight this as a critical public health need and a contribution that Canada needs to commit itself to in the global effort. Write to your member of provincial parliament, and importantly, write to your member of parliament and bring to their attention your commitment to work with the government to advance research and innovation and the government's need to support it financially.
Great. And Saskia, how about you? Is there one thing you'd want our listeners to know about how they can help to move the strategy forward, and a resource that maybe they can use to do that or to support themselves in their fight against dementia?
Yes, I echo Bill's words. The reason we have a national dementia strategy is because we had people living with dementia, those been touched by dementia, who asked for it, who advocated, who pushed for it over 10 years. And, it doesn't stop here. We have a strategy, but the proof is in the pudding. It will be in the implementation and the resourcing of the strategy that we will truly be able to reach the heights that we can and are able to aspire to as a country. And on that global stage, as Bill was talking about it. I'd say in terms of learning more and engaging yourself, absolutely read the strategy. There is an annual report that is also produced monitoring the progress of the strategy. One has just been released by the Public Health Agency of Canada. It's available on their website and linked on our website as well. And there will be more. And so you'd need to advocate with your member of parliament to resource the strategy and to help push forward the implementation. In terms of how you might be able to engage as an innovator or a researcher, of course, there are a multitude of programs available. You can absolutely also look at the Alzheimer Society research program, the proof of concept program in particular that I mentioned. And if you're a person living with dementia or a caregiver, please reach out to us through our First Link program. It is here to help support you navigating the health system.
That's great. As we close this episode on Canada's National Dementia Strategy, I just want to thank both of you, our guests, Doctors Bill Reichman and Saskia Sivananthan, for joining us for this conversation. We also want to thank our podcast production team, including Ariel Townsend, Jonathan Suckling, Margaret DeRocha, and Dustin Cantor. Dustin's from Podtex. I also want to throw out a thank you to the former health minister, Minister Pettipat Taylor, who was the health minister when the National Dementia Strategy was initially being conceived and formed, and the current health minister, Minister Haidu, because she's now responsible for moving it forward. And I know, Bill, you're working quite closely with her in that capacity, as well as with the Public Health Agency of Canada. We're really grateful for the insight that they've had in recognizing, as you've said, that we needed to take this to the national level to be able to see real impact. And I'm certainly quite hopeful about where we can be going. And I just want to say thanks to them as well.
So to learn more about CABHI, please visit us at www.cabhi.com. And I also want to give a shout out to our guest organization. So to learn more about Baycrest and its offerings, please do visit www.baycrest.org and the Alzheimer Society of Canada at www.alzheimer.ca. We'd also love your support of our podcast, so be sure to follow us and leave a review on SoundCloud, Spotify, Apple Music, or wherever you get your podcasts. As we continue to navigate these ongoing unprecedented times, we hope that all of our listeners stay safe and well. Thank you.